Welcome to tonight's AIP treatment planning session. This is actually the second session for January, so that is February 1st, and welcome. Thanks for joining us tonight. We've got a big crowd tonight. We're going to talk about a few things tonight. I'm going to talk specifically about treatment planning in a little bit different way in how we can develop a progressive treatment plan, letting the patient know different options and then how we can present those options to the group. First, is there any announcement? Yeah, we are going to have a special webinar. Daniel and I are putting together some educational packages which will be useful for all members, but particularly the newer members, to kind of get you up to where the rest of our members have been, who have been here for the past 2.5 years. So we're putting together those educational packages right now. We're excited about them. Daniel and I met for about an hour yesterday, and we still have more meetings to do so that we can put together some packages that'll be really useful to all of you. So let's take a look, and we'll announce that webinar well in advance so that you can join us for that. Let's look at the treatment planning session. Let's figure out what we can do in what I've entitled the progressive treatment plan. So this patient is actually a patient that I know. He happens to be the wife of one of my staff members, and we've known him for a few years. I'd never seen him, but since his wife is one of the hygienists in the office, she had seen him. So she finally came to me and said, listen, I've been talking to him for years. It's finally got to the point where I want you to see him. And so he came in. Hasn't smiled in years, hasn't received the dental work that he should have. He has pain on the upper right side on his 2 remaining teeth, and that he has to chew on, and he's finally ready to look at treatment. So that is the patient phone call, and that's the intake that we get. Second thing is the doctor phone call, of course, and I call him, and essentially what he told me was exactly the same as what he told Samantha. And so based on the description, I ordered in writing an FMX and a CT. So of course on the doctor phone call I can pretty much guess what we need. So when the patient walks in, he's immediately taken to the assistant. The assistant takes the full mouth series and the CT scan. Okay, now these are the assistant notes. This is part of the interview that occurs when the assistant is meeting with the patient. The patient states no discomfort, and the teeth aren't loose. He just knows it will fall out soon. So there'd been a change in the status. Patient states his parents were both in dentures by the time they were in their 20s, and when he met his wife, he realized the value of saving his teeth. He had a partial, but was never able to chew with it. He states he's always had bad teeth and just wants something he can chew with, and to keep his teeth he has for as long as possible. So these are my notes referred by spouse, and there's the medical history is non-contributory to his problem. Remember, as we're going through this, remember there are 4 things the patients want, and I'm going to drive this point home to the point where you may be sick of it. Just send me an email saying you're sick of it, but for me it's important that we remember this. Patients only want 4 things. They want to smile, they want to chew, they want no pain or freedom from pain or no pain in the dental chair, and they don't want their mouths to stink. Those are the 4 things that patients want. So let's take a look at the periodontal chart first. You take a look and you can see there's some periodontitis that's present. There's a fixed bridge in the upper right side, periodontitis in the anterior, and these pockets between these 8 and 9 are pretty bloody pockets. Also, you'll see that he's in very close to an Angles Class 3 malocclusion. So let's look at the x-rays now and see what those x-rays show. Okay, so we take a look up here and you understand and you see that the patient has a fixed bridge that is pretty badly failing. This was the radiograph in 2014. This is the radiograph today. So you can see, of course, that there's nothing much that can be done there. I don't have a good current picture of the canine tooth. I'll give you the central incisors. I'll give you the left canine tooth. And things are pretty good there periodontally, aren't they? If you take a look at the posterior teeth, look at posterior teeth here. We've got a CT scan, so I apologize for missing the apex on tooth number 20. But actually, those were X-rays from 2014. The only current X-rays we took were those PAs. Was the one that we took on the upper right side. But good root length. I mean, this is a pretty good condition given the state that he's in. If we look at the CT scan, we'll see a few things. Number one, if we look across here, you'll notice, and by the way, I'm doing this as I'm talking with the patient. You know, Hank, if we take a look at this tooth is in trouble in a lot of different ways. You can see the root on the facial here. This is towards the palate, so this is your cheek side. This is your palate over here. You see this big dark area here? That's an infection right between the roots. You see this white line here? That's a very, very thin layer of bone that's separating this infection from your sinus. Now, there isn't a hole in your sinus yet, but this infection is developing. It's getting bigger and bigger and bigger, and this infection could create a sinus problem for you later on. So let's move across here, and we'll take a look at a couple of other things. There's a couple of things I'm looking at when I'm looking at these x-rays. Number one, I want to see how wide the bone is. You know, if we're doing dental implants, if we're considering that, we want to know how wide the bone is. Well, the bone is 6.64 millimeters. We need about 5.5 millimeters. You've got a 1 millimeter more than that, you're good for a dental implant. And there's plenty of length. There's 12 millimeters of length, so we could put a dental implant in there. If we move across, you'll notice there's a bit of an hourglass shape here. If we measure the width of the bone right in this area here, remember the magic number is 5.5. Well, it's 5.44. That's close enough so that we could put a dental implant in here if we chose to. Now, I want to tell you, the patient told me, listen, I'm 65 years old. If I were 35 years old, I would rebuild my mouth, but I'm 65 years old, which essentially, you've all heard it. That means that he doesn't want to spend any money because there's no longevity associated with that. And now that I'm 66, that's pretty depressing to even listen to. So I'll be able to argue with that more at my age than some of you younger people will be able to argue with that logic. But we look across here, you won't be able to see much of the periodontitis here. But now we look at the left side, and we're looking at the same thing. I want you to be able to see the width of the bone here, and notice that the width of the bone here is fairly narrow, you know. 5.32, and we've got good length here, so that's a place where we'd be able to put an implant. We might have to do a little bit of a bone graft here, and then if we go here, we've got the sinus in place. So we're going to have to really work to be able to give you some teeth. Let's look at this in a little bit different perspective so we can see what we can show you, meaning what we can show the patient. And I want to show you one thing, and that is, you all know I love the Anatomage software. I can show a patient on the Anatomage software something that we can never show on the iCat software. Now, there are other imaging softwares as well. You don't have to get the Anatomage, but I like this one. And what I want to show you is this. I say, you know, you've got a tooth hanging out here that isn't in contact with anything here. So there's actually an extra tooth on the lower. You see that? And by the way, when you lose this bridge on this side, the bridge is being supported by this tooth and this tooth, you'll have the same extra tooth on this side. So it means you'll have one more tooth on the upper than you will on the lower. And just to give you an idea, I want to show you some photographs. So let me just show that so you can see the patient. So there he is. Okay, so we know this bridge is going to fail. Canine's okay, lateral's okay, but we have some periodontitis going on here. Fairly significant periodontitis going on here on number 8. Take a look at the teeth apart a little bit. If we take a look at the upper left side, again, you can see you have an extra tooth here, and there's a blank space up there. So we can utilize that blank space to fill something in. And if we look at the right side, here's your bridge, and your bridge is failing. But these teeth are solid. They're in occlusion. They have periodontal disease, and so that means that disease continues. Then those teeth have a chance of getting loose and coming out. And Hank's already told me that he wants to keep his teeth. So that's the picture that we have. Let's take a look then at Let's go back to the Anatomo software. I want to show you how useful that can be. So this is the bone view, which isn't going to be very good on this because there's a lot of scatter on the bone view that you won't see on the teeth view. Let me increase the brightness and the contrast a little bit. So let's talk about how we can replace these teeth. So the first thing I'm going to do is place an implant here in the number 12 area. This implant will line up with this tooth here. We already know there isn't much bone here, so I'm going to place an implant here at an angle. And we'll place a number 19 here. So we'll restore one side, and we can give you one good chewing side. We'll work with that in a second. I just want to show you that we will ultimately be able to do exactly the same thing on this side. We'll place an implant here. We'll likely place an angled implant here. And we'll place an implant down here. So you see how all of these line up? You see how this implant will line up with this implant lines up with this tooth, and the same thing on this side. This implant will line up with this tooth, and this implant will line up with this implant. That'll give you two good chewing sides. And well, by the way, we'll take the stress off the front teeth, because now the back teeth are in function. So now the teeth that have periodontal disease will have a little bit of help, because we're giving you something to chew on and to meet in the back. Let's take a look at how that might look in the mouth. So let's look at this implant first. This is the area where we thought we might not have enough bone. Let's see what we can do about that. Let's put a narrow implant in there. And we might need a little bit of assist with bone grafting. Danielle, I think we may have to do a little bit of bone graft here, probably a 2-unit bone graft, so that'll be for number 12, just to make sure we have enough bulk of bone so that we can hold on to this area and make sure the implant is as stress-free as possible. Okay, let's put another implant in here. And that lines up well. You see the bone is good right here. That looks good. Probably angle it out a little bit. And let's look at the implant that'll be chewing against. You know, the bone's a little bit narrow here, but I think we can make this work without a bone graft. It looks like it'll be thick enough that we'll be able to make this work. Let's look at what we may predict and what we may be doing on the other side later on after we extract the teeth and take care of the infection on the upper. So we will look at this implant and put the implant to the number 5 area. And look, Hank, you actually have better bone here on the right side than you do on the left. I don't think we'll even need to do a bone graft there. As a matter of fact, we can put in a nice long implant. Look at that. Plenty of room for a big long implant. And again, we'll put an angled implant here. So that we'll angle it around the sinus, and that will eliminate the need for us to do a sinus lift. So we won't have to go into your sinus with a surgical guide, which will allow us to duplicate exactly what we put in on the computer. We can place a surgical guide and exactly line up the implants just like this. We'll be able to just line the implants up perfectly. Now those are just implants. Let's take a look at what it would look like with teeth on them. Okay, so let's work with this for a second, and let's see how we can get these teeth to line up and how we can get them to touch. So here we go. Good. Let's make this one a little bit wider. I think we may make this one a little bit wider too. So now they touch each other. Now we've got a big molar tooth, two big chewing teeth on the upper that will bite against the lower tooth. Now, Hank, at minimum, we would put a single implant in here, just this implant, and that could bite against your one natural chewing tooth. But this, if we only put this one implant in here, you've got muscular forces. You know, you have the same muscles in your jaw, whether you have one implant or 5 implants. And one implant, that places a lot of burden. You see how this one implant is taking the force for what used to be 4 teeth back here. I don't think I can guarantee that. But if we put an implant in here, put an implant in here, and put an implant in here, now we have something that better duplicates what you used to have. And I think we can guarantee that. I think we can put a guarantee on that. Now, that will be good. But later on, in order to be able to really help support your teeth, you know, don't forget, we've got teeth that we need to support here. It would be good to be able to do the same thing on the right side that we do on the left side. So let me just work with that for a second and get that in place. We'll make that just a little bit wider. And now we have one big chewing tooth here. And we can put one big chewing tooth here. It's a little bit too wide, but you get the idea. And now we have teeth in contact on both the right and left sides. And for the first time in a long time, you'll be able to chew both on your right side and the left side at the same time. Now we can build on this. We can take care of the infections first. We'll take out the teeth on the upper right side. And we'll put implants in on the upper left side. And we'll take care of the periodontal disease in the front. And that'll get you started. So then you'll have one chewing side here. You'll be free of infection. We'll be able to take care of the periodontitis on this side. After we've taken out the teeth on the right side and this bone is healed, then we can start working on dental implant therapy on the right side as well. How's that sound to you? And Hank says, you know, it depends on how much it costs or whatever that is. So then well, Danielle, is there anything you'd be saying at this point?
Well, before I take Hank to the financial room, I'm going to ask a few questions in front of Hank while you still have all this up in front of him. And my first thing is, Dr. Sheldon, you mentioned the need of a surgical guide. Do you need a surgical guide on the upper and the lower?
No, I think we'll be fine on the lower. I think in the upper, we're trying to angle around the sinus, and I want to make sure that's precise. So we'll need a surgical guide for that side, for the upper only.
All right. And how much material are you going to need, and what materials are you going to need for this procedure?
I think number 12 will use PRGF and Mineros. Probably need 2 grafting units in order to be able to get this done.
Okay.
Now, when I say 2 grafting units, what does that mean to you?
Well, our units are, I know we just did a fee increase, so I can't quote on that. But
Okay.
Our unit price is $250. Our grafting unit price is $375. So times whatever units you give me, it's a nice code to use because the patients don't know what a unit price is. But the unit tells me cost and it tells me time. So I know how much to schedule this for, and I know how much to charge for this.
Good. So a unit in our office really means 10 minutes.
Yes.
Ordinarily, that means that what I say is 10 minutes is charged out as a unit. Occasionally, I'll say I need 3 units, but give me 50 units. Give me 50 minutes for surgery. But usually, a unit is a 10-minute unit. And therefore, there isn't one extraction fee. You know, we've got. On the upper right side, we're going to be taking out teeth numbers 3 and 5. That's going to be 4 units to take that out. 4 units to take those teeth out. By the way, when I take those teeth out on the upper right side, Hank isn't sure he's going to get an implant, so don't waste his money on grafting now.
Okay.
If he decides to do it later on, I'd rather he spend his money on where he's going to get the best function, and that's going to be on the left side for now. Okay.
Now I understand that Hank's not in pain right now, but he was in some pretty severe pain last week.
Yeah.
So he's not chewing on the right side, even though he's got some teeth to do so. So the replacement that you're doing on the left, is that going to give him equal chewing surface that he had, say, a month ago?
Actually, it's going to give him more. If we put a molar tooth on the lower left side, he doesn't have a molar tooth now on the lower right. So we actually have more function than he has right now.
All right. And is there any benefits to building up the right and the left at the same time?
Well, I think ultimately, if we remove, first of all, if we take out the teeth on the upper right side, there's so much infection there. I wouldn't feel comfortable putting implants in on that day.
Okay.
I'd prefer the teeth come out. I prefer that the infection
Okay.
be gone, and wait a few months, maybe 3 months, 4 months, and then it'll be ready for implants on that side.
Got it. And when that bridge comes out, when you take that bridge out, is it going to show when he smiles? I know Hank says he doesn't smile, but if he were to smile, would it show that this bridge is missing on that side?
It will. It's definitely
Okay.
going to be a blank space there, but it's not going to be any different from the space he already has on the upper left side.
Okay.
If you take a look at this, you can see all he has is a
Oh, I
canine
see.
here, so now I have the
Yes.
canine here, so it'll look exactly the same.
Okay. Got it. Okay. Well, that's all I need to put this together for Hank.
Okay. Now for the periodontal portion, it's going to be an EAPT 1.
Okay.
EAPT 1. EAPT 1 for us is perioscopy. That's endoscopically assisted periodontal therapy. When I see somebody for periodontal treatment, more often than not, it's going to be endoscopically assisted periodontal therapy. Most of you know that we've been using that, and for us, it's kept most of our patients out of periodontal surgery. And EAPT1, EAPT2 essentially means that there are oral hygiene visits, that there are some light nutrition visits, as well as one perioscopy procedure that'll last 1 hour. And then a few weeks later, there'll be a full prophylaxis visit, and this will all be comprehensive, one single fee, and I'll do a reevaluation to make sure the periodontitis is under control. So that's one bursting code if you want. It's a dictated bursting code. If I say EAPT1, we know that there's a series of visits that Danielle is going to schedule for that patient.
Right. And so at this point, I'm going to take Hank to the financial room and I'm going to go over everything with them that I just got from Dr. Sheldon. So when Hank and I sit down into the room, I'm going to do some reiteration so that, for one, he can be aware that I've got everything, and two, I can answer any questions and make sure that he has the entire information before we carry on. So, Hank, right now, the main concern with you coming in is, a few weeks ago you were in that pretty severe pain, and doing the diagnosis today, we can see you have a pretty severe periodontal infection up on that upper right, as well as a pretty severe decay on the other end of that bridge. So all in all, that bridge is going to have to go. But you knew that before you came in here. So the first option I'm going to give you is going to be to get that infection out of your body, because you don't want infection in your body. That's obvious. And to also clear up the periodontal disease that you have in other parts of the mouth, because you do have, as you could see from the perio charting that we did today, you do have some pretty severe pocketing on the upper teeth as well. So we're going to take care of all that. You had mentioned earlier on in this appointment that your mom and dad had dentures at an early age, so we don't want to put you in that same situation. So taking care of this periodontal disease and doing what we call EAPT, that's the endoscopic periodontal treatment, non-surgical. So we can take the endoscopic camera, go down below the gum line, see this bacteria, see this built-in calculus, get it out of there, as well as combine that with some nutritional counseling on there to make sure that you're eating the right way, make sure you're taking the right supplements, make sure you're doing the correct home care, and have you come back here for some coaching on that, as well as some follow-up cleanings, which it will end up that you're going to come here about every 3 months or so to have your teeth cleaned, which is nothing at all, just for that maintenance. In this disease that you have is the same disease that your parents had. That's why they were in dentures early. It's a disease that takes your teeth away. But we can control it. We can keep it under control. And just coming here for maintenance is going to take care of that. So we will do that. We're going to take away that pretty severe infection you have on the right side, clear all that up, take care of the periodontal pocketing that you have on the other areas of the mouth. And we're also going to do the implants on the left side so that we can give you a chewing function. Right now you don't have a chewing function. You're using all those anterior front teeth to do all your chewing, which they already got some periodontal issues, and so they're not the strongest and the best right now. So we're going to give you the implants on the left side, give you a nice biting surface to chew on that side, get rid of all the periodontal disease, get rid of the infection, and that is where we're going to start. That's what you came in for. That's the minimal treatment you'll need to achieve that, and that's what we're looking for. So with that, Hank, here is the treatment plan that I have for you. And it shows that the surgical portion to do the right side, giving you the surgical guide, the 2 implants on the upper left, the 1 implant on the lower left, to extract that bridge with that infection in there, and to as well do the periodontal treatment with everything that I told you it includes, which is the non-surgical endoscopic treatment, the coaching visits, the nutritional and the supplements, everything in there. All that ends up being $8,140, and that's the most important thing that we have on the agenda, step number 1. The next step is when you come back a few months later, we're going to be doing the crowns and the abutments to put some teeth on those nice healthy implants. And for those crown work, it's going to be $7,500. So all in all here, the treatment that you came in for today is going to cost $16,535. You have 3 options for that. The very first one is we have this great financing company. It allows you to make payments for 12 months, no interest, which is like free money. It ends up being about $1,300 a month, but once you get that paid off 12 months, you're done. If you don't want to do that, we can do a pay in full, give you a 5% discount. That's saving $827, which is a pretty big chunk, and that brings it to $15,700. And then the last option you have is to phase it out. You can do the surgery first, pay the $81.40. You can do the periodontal treatment right after, $895, and then when it's time to restore the implants, do it then, $7,500. So you can do that any way you'd want. Before we decide on that, I just want to let you know that to go on ahead and plan the right side, if it's something that you really want to do, because I know that you said you don't really smile much, but I would love to see you start smiling and see how much you enjoy that. And that would be by doing the implants on the right side. Now, like Dr. Sheldon said, he wouldn't do it right away, but we can go on ahead and plan for that and get it on the schedule down the road. So if we were to go on ahead and put the upper right side in the plan right now, it would be the 3 implants on the right side, same thing as the left, 2 on the upper, 1 on the lower, and also doing the restorations to give you the same chewing function, plus when you smile you see the teeth in the area. So you'll have the nice smile, you'll have the 2-side chewing function. That's an additional $13,813 to do that side. Now, the reason why I want to put this into the mix now is because if you go on ahead and do everything, just decide to go on ahead and start everything today, then all together for both sides and the periodontal treatment, it comes to $30,348. I can do a 10% discount if you want to do both sides starting now, and that's a saving of $3,000. So it's a pretty huge chunk of change, and it brings the total to $27,313. A few things with this is, one, you can use this expense for a tax write-off. So you can use this as for your dental medical expenses for that, and also, of course, whatever your insurance will pay for this, we're going to submit everything for you to get you that part back. But it's something to at least consider. If you really want to do both sides, you can save an awful lot by going ahead and decide now and receiving the maximum discounts for that. So which one sounds better to you, Hank?
Well, I think at this point I just want to concentrate on the infection, and I really only want one chewing side, so I think I'll do the implants on the left side.
Well, that's why you came in today.
Yeah.
That's what your focus is. We can always do the other side whenever you're ready. So that's what we'll do. We're going ahead and put you on the schedule to do the extraction of that bridge, get that infection out of there, do those implants on the left side, start your periodontal treatment, and we'll get all that started. So the 3 options I gave you, Hank, in the beginning for that side, did you want to do the 12 months interest-free for the $1,300 a month, or did you want to save the 5% discount, which is $827, and just go ahead and take care of that today?
No, I think I've got to space it out, so I'll do the 1300 a month.
Okay. Yes, that is a popular one. It is interest free. So all you do is just make your payments as long as it's paid within 12 months. Absolutely no interest at all. So that's fine. If you want to hold tight here, Hank, for just a few minutes, I'm going to go on ahead and get this financing paperwork started. It takes me 5 minutes, real quick, and I'm going to go on and get you scheduled for this surgery. That way we can go over the pre-op today, consents today, and get everything rolling today, because I want you to get this infection out as soon as possible, so let's not waste any more time.
All right, good. So that's the idea of the treatment plan. Understand that with the, and Danielle actually didn't ask me as much questions tonight as she ordinarily would in the operatory. Danielle's a pain in the neck in the operatory. She keeps on asking questions that she thinks the patient would be asking, and she'll do that in the middle of the examination. It will be, well, what would happen if you didn't do that? Or what's the reason you're doing that? All of those things are great, because then the assistant is involved. The assistant is taking the patient's viewpoint. The patient often is afraid to ask questions because he doesn't want to seem dumb or whatever it is. And so Danielle takes that position. What would happen if he did do this? What would happen if he didn't do that? What does that mean? All of those types of things come from the assistant, and all of a sudden now it's the assistant and the patient working with the doctor, or against the doctor. I was going to say against the doctor, and it works out very well.
I think it works out very well, because when the patient has a sense that I don't want to say I'm not on your side, but we're not working together to maximize his pocket, I think that he starts to loosen up a bit and starts feeling comfortable, because I am saying things like, can you just do, one implant on the upper, one implant on the bottom? And why does he have to have two? But you had already explained that to him during the CAT scan, so I didn't ask that again. But I do ask stuff like that, because I don't want him thinking that he's being overtreated. And if I'm asking the questions and you're providing the answers, he doesn't have those hanging over as I'm trying to present the case to him. So it really makes things a lot easier to go on ahead and throw those out. It doesn't matter how dumb you think the questions are. Like, I'll even ask, why are the teeth loose? Well, I know they're loose because they're diseased. They have bone loss around them. But I'm going to ask those questions because I want Hank to hear the reason why his teeth are loose. So it does help.
Good. Anything else? I don't see any hands raised. Any hands raised? Anybody want to ask any questions? Let me just get the screen out and see if anybody is asking anything. No, you're not.
It's quiet.
And nobody's texted anything? Nobody said anything. All right, good. Well, listen, it's great. We're going to get together again is it next week? I forgot what's next schedule.
It's not, I think, until the 15th, but we will be announcing soon the bonus webinar that we're going to go over some pretty exciting packages that it more or less gives you so much for your practice. It's kind of like combining consulting with membership to give you so much more interactive assistance from Dr. Sheldon and I.
Yeah, it'll be a lot of fun. So we'll keep in touch with you. Love your emails. By the way, get on that Facebook page. Yes, we got a Facebook page, and Audra Ward has really helped us out a lot with that to get that going. We'll put some cases in, put up some problems, share those problems and solutions together, and try to make this even a greater benefit for all of Perio. So thanks for joining us. Thanks for being with us, and look forward to talking with you soon.
Thank you.